1. What is the primary purpose of a train-the-trainer program for CNA instructors? A. To certify CNAs for medication administration. B. To prepare CNAs for direct patient care. C. To develop instructional and mentoring skills. D. To fulfill state licensure renewal requirements. 2. According to adult learning theory, which method best promotes engagement? A. Repetition drills. B. Passive lecture. C. Interactive case studies. D. Assigned readings. 3. Which of the following is a key responsibility of a CNA preceptor? A. Supervising all facility staff. B. Enforcing facility policies on behalf of administration. C. Mentoring and evaluating new CNAs. D. Administering medications. 4. Which approach aligns best with constructivist learning theory? A. Providing a strict curriculum checklist. B. Allowing learners to build on prior experiences. C. Focusing on rote memorization. D. Relying on repetitive demonstrations. 5. A new CNA struggles with completing a bed bath. What should the preceptor do first? A. Report the issue to the Don. B. Reassign the CNA to another task. C. Redemonstrate the skill and provide guided practice. D. Give the CNA written steps to study. 6. Which best describes formative assessment? A. State certification exam. B. Licensing renewal test. C. Continuous feedback during learning. D. Final clinical evaluation. 7. What strategy enhances retention for adult learners? A. Isolated memorization. B. Frequent pop quizzes. C. Real-world application. D. Lecture-based teaching. 8. What does scope of practice mean in CNA instruction? A. The facility's hiring policy. B. Legal boundaries of CNA duties. C. Patient preferences. D. Preceptor responsibilities. 9. The best way to manage a disruptive student in a CNA training class is to A. Ignore the behavior. B. Publicly reprimand them. C. Privately address the issue and set expectations. D. Remove them from the program immediately. 10. A CNA instructor must document student progress. A. Only at the end of training. B. Whenever convenient. C. On a daily or sessional basis. D. Only during skills testing. 11. Effective CNA curriculum includes A. Only lecture-based content. B. State-required topics and hands-on practice. C. Only written assessments. D. Weekly facility inspections. 12. When giving feedback to a struggling learner, it should be A. Critical and firm. B. General and brief. C. Specific, timely, and constructive. D. Public to encourage competition. 13. Which is most important when teaching infection control? A. Sterile technique in surgery. B. Resident dietary needs. C. Standard precautions and hand hygiene. D. Resident financial information. 14. A CNA student demonstrates unsafe patient care. What is the instructor's first responsibility? A. Dismiss the student. B. Notify the patient's family. C. Stop the unsafe action and provide correction. D. Report the student to the state. 15. Which is the best technique for evaluating clinical competency? A. Multiple choice test. B. Verbal questioning. C. Skills demonstration with checklist. D. Self-reporting by students. 16. The term andragogy refers to A. Pediatric learning. B. Learning styles in young children. C. Adult learning principles. D. Staff conflict resolution. 17. During role modeling, a preceptor should A. Delegate tasks only. B. Criticize errors immediately. C. Demonstrate best practices while explaining rationale. D. Let the learner watch passively. 18. CNA instructors must ensure their training program A. Minimizes clinical hours. B. Avoids complex topics. C. Complies with state and federal requirements. D. Skips OSHA compliance. 19. Which is a hallmark of learner-centered instruction? A. Instructor lectures 90% of the time. B. Passive note-taking. C. Learners actively participate and solve problems. D. One-size-fits-all curriculum. 20. Which activity most supports critical thinking? A. Memorizing procedural steps. B. Watching a training video. C. Participating in scenario-based simulations. D. Reading textbook chapters. 21. What's a primary benefit of using simulation in CNA instruction? A. Shortens clinical hours. B. Reduces student anxiety. C. Provides a risk-free environment to practice. D. Decreases instructor workload. 22. The best method to assess student learning outcomes is A. Student self-assessment. B. Pre- and post-testing with performance evaluation. C. Group feedback. D. Peer review. 23. Effective preceptors are A. Authoritative and hands-off. B. Passive observers. C. Supportive and skilled in communication. D. Focused on administrative tasks. 24. An instructor who adapts materials for learners with dyslexia is demonstrating A. Non-compliance. B. Universal design for learning. C. Standardization. D. Bias. 25. In debriefing after clinical, the instructor should A. Correct errors immediately without feedback. B. Allow students to reflect on their actions. C. Reprimand students. D. Only summarize key points. 26. One way to promote cultural competence in CNA training is A. Avoid cultural discussions. B. Enforce a single care model. C. Incorporate diverse case studies and patient scenarios. D. Require learners to learn a new language. 27. A CNA preceptor modeling empathy is A. Sharing their personal life. B. Performing duties without interaction. C. Acknowledging patient concerns and emotions. D. Making clinical judgments for others. 29. A key characteristic of a good mentor is A. Dominance. B. Passive listening. C. Approachability and guidance. D. Focus on perfection. 29. A key characteristic of a good mentor is A. Dominance. B. Passive listening. C. Approachability and guidance. D. Focus on perfection. 30. Which is considered a measurable learning objective? A. Understand patient rights. B. Know infection control rules. C. List 5 signs of elder abuse. D. Be aware of HIPAA. 31. The best way to accommodate different learning styles is to A. Use only visual aids. B. Teach with one method. C. Integrate auditory, visual, and kinesthetic activities. D. Avoid group discussions. 32. Why are rubrics useful in CNA instruction? A. To reduce grading time. B. To provide clear expectations and consistent assessment. C. To replace practical testing. D. To give open-ended feedback. 33. Which quality best supports a positive learning environment? A. Strict discipline. B. Instructor bias. C. Respect and inclusiveness. D. Uniform instruction. 34. CNA instructors should review their teaching effectiveness by A. Ignoring student feedback. B. Assuming all learners succeed. C. Evaluating outcomes and reflecting on methods. D. Using outdated lesson plans. 35. Which is an example of intrinsic motivation? A. A bonus check. B. Class grade. C. Desire to improve patient care. D. Completion certificate. 36. Which federal law governs privacy in CNA instruction? A. ADA. B. FERPA. C. OSHA. D. HIPAA. 37. A new preceptor should receive training in A. Advanced medical coding. B. Mentoring and evaluation techniques. C. Surgical procedures. D. Legal documentation. 38. How often should feedback be provided during skills training? A. Monthly. B. Only after testing. C. Immediately and consistently. D. Quarterly. 39. What should an instructor do when a student fails a skill? A. Dismiss the student from the program. B. Retest without discussion. C. Offer remediation and reevaluation. D. Ignore and continue. 40. Which skill is essential for conflict resolution in clinical training? A. Avoidance. B. Direct authority. C. Active listening. D. Documentation. 41. What is the main purpose of clinical rotations in CNA programs? A. To pass time between lectures. B. To allow students to shadow nurses. C. To provide supervised hands-on experience. D. To complete paperwork requirements. 42. Which is the best way to ensure consistency in CNA instruction across multiple instructors? A. Allow each instructor full freedom. B. Use a standardized, state-approved curriculum. C. Have instructors create their own training. D. Let the facility determine instruction style. 44. A CNA preceptor is acting as a role model when they A. Delegate difficult tasks to students. B. Demonstrate proper technique and explain why. C. Allow students to perform all tasks alone. D. Grade without observation. 44. A CNA preceptor is acting as a role model when they A. Delegate difficult tasks to students. B. Demonstrate proper technique and explain why. C. Allow students to perform all tasks alone. D. Grade without observation. 45. The best way to promote reflective practice in students is to A. Avoid post-clinical discussions. B. Require daily journaling and group debriefings. C. Give weekly quizzes. D. Allow learners to skip discussions. 46. Which document outlines the minimum requirements for CNA programs? A. Institutional bylaws. B. OBRA regulations. C. OSHA safety checklist. D. Medicare handbook. 47. When providing feedback, which technique should be avoided? A. Sandwiching positive and negative feedback. B. Giving vague comments like "good job." C. Offering specific examples. D. Encouraging self-assessment. 48. Which of the following is the best tool to track individual student progress? A. Attendance sheet. B. Evaluation rubric and skills checklist. C. Peer reviews. D. End of course survey. 49. CNA instructors are legally responsible for A. All patient care at the site. B. Scheduling of facility staff. C. Ensuring students are safe and supervised. D. Employee benefits management. 50. The most effective method to reinforce ethical behavior in CNAs is to A. Memorize codes of conduct. B. Apply ethical principles in role play and clinical scenarios. C. Complete a written exam only. D. Read the employee handbook. 51. Which instructional method promotes peer learning? A. Independent study. B. Simulation labs. C. Group discussion and team activities. D. Skill return demonstration. 52. A CNA instructor suspects a student is experiencing test anxiety. The best response is to A. Ignore it unless scores drop. B. Offer reassurance and test-taking strategies. C. Reduce test difficulty. D. Let the student skip tests. 53. A competent CNA preceptor must possess A. At least a high school diploma. B. Strong clinical knowledge and teaching ability. C. Advanced administrative training. D. Minimal interaction with students. 54. Which outcome indicates a successful clinical preceptorship? A. Student memorizes textbook content. B. Student is able to perform skills independently with confidence. C. Instructor completes all paperwork. D. Facility passes inspection. 55. One challenge of being a CNA instructor is A. Not enough administrative work. B. Having limited interaction with learners. C. Balancing teaching, evaluation, and legal compliance. D. Avoiding clinical duties. 56. The term constructive feedback implies A. Sugar-coating criticism. B. Immediate dismissal for errors. C. Specific, actionable, respectful communication. D. Avoiding confrontation. 57. During CNA training, HIPAA should be A. Discussed only during clinicals. B. Reviewed with a simple handout. C. Fully integrated into all training and practice sessions. D. Covered only at orientation. 58. A CNA instructor must report suspected student abuse of a resident. A. Only after internal investigation. B. Immediately, per mandatory reporting laws. C. To the instructor's supervisor within a week. D. To another student for peer mediation. 59. Which is the most appropriate way to prepare learners for the certification exam? A. Provide questions from previous exams. B. Simulate real testing environments and reinforce core competencies. C. Tell students to study hard. D. Use only textbook multiple choice. 60. Which describes the difference between summative and formative assessment? A. Formative is final, summative is during. B. Formative is optional, summative is required. C. Formative guides instruction, summative evaluates final outcomes. D. They are the same. 61. CNA instructors should collaborate with A. Only other instructors. B. Department heads and regulatory bodies. C. Family members of residents. D. Legal teams only. 62. CNA preceptors who display emotional intelligence. A. Avoid emotional topics. B. Recognize and manage their own emotions and others. C. Use emotions to control learners. D. Suppress all emotional responses. 63. A key responsibility of a train-the-trainer graduate is to A. Train facility management. B. Conduct CNA classes that meet regulatory standards. C. Perform all facility CNA work. D. Supervise all facility employees. 64. The best way to align instruction with learner needs is to A. Assume all learners are the same. B. Conduct a needs assessment early in the course. C. Let students choose the entire curriculum. D. Skip initial assessments. 65. A student reports feeling bullied by a clinical staff member. The instructor must A. Ignore it unless there are witnesses. B. Ask the student to handle it. C. Follow institutional protocol for reporting and intervene appropriately. D. Wait to see if it continues. 66. Which best illustrates a measurable outcome? A. Learners will understand infection control. B. Learners will demonstrate correct PPE use during clinicals. C. Learners will know about ethics. D. Learners will discuss nursing history. 67. What's an effective way to improve instructor-student rapport? A. Maintain strict distance. B. Regularly engage in respectful, open dialogue. C. Avoid informal feedback. D. Communicate only through email. 68. CNA instructors can prevent student burnout by A. Assigning more independent study. B. Promoting work-life balance and stress management. C. Repeating lectures to reinforce learning. D. Reducing skill lab hours. 69. CNA preceptors reinforce infection control by A. Referring students to policy documents. B. Strictly modeling and enforcing proper hand hygiene. C. Ignoring minor errors. D. Avoiding shared equipment. 70. CNA instructors should use which method to reduce language barriers? A. Avoid diverse students. B. Use complex medical terms regularly. C. Supplement instruction with visual aids and demonstrations. D. Provide fewer instructions. 71. The primary role of a preceptor in a clinical setting is to A. Supervise only. B. Serve as evaluator only. C. Teach, support, and evaluate. D. Take over the CNA's work. 72. In CNA instruction, teaching to the test should be avoided because A. It increases certification rates. B. It limits critical thinking and comprehensive learning. C. It saves time. D. It meets only minimum standards. 73. A strong clinical learning environment includes A. Unstructured supervision. B. Access to diverse patient populations and guided reflection. C. Peer-to-peer grading. D. Isolation from instructors. 74. Instructors can ensure skill competence by A. Watching group demonstrations only. B. Using standard checklists and direct observation. C. Asking for verbal reports. D. Testing at the end of the course only. 75. Which factor most contributes to student retention? A. Instructor credentials. B. Access to advanced technology. C. Supportive learning environment. D. Stringent grading policy. 76. Which leadership style best supports adult learners? A. Authoritarian. B. Laissez-faire. C. Democratic and participatory. D. Passive-aggressive. 77. Which of the following enhances clinical reasoning in students? A. Case-based discussion and simulation. B. True or false testing. C. Repeating tasks without feedback. D. Group presentations only. 78. CNA instructors use evaluation tools to A. Punish poor performers. B. Measure compliance with HIPAA. C. Guide instruction and assess learner growth. D. Replace clinical supervision. 79. CNA trainers are expected to stay updated through A. Watching TV medical dramas. B. Online forums. C. Continuing education and professional development. D. Student feedback only. 80. CNA instructors should advocate for students by A. Ignoring personal challenges. B. Encouraging dependence. C. Helping navigate barriers to learning. D. Changing the curriculum for them. 81. CNA students must complete how many supervised clinical hours varies by state? A. 16. B. 30. C. 75. D. Minimum required by OBRA, often 16 or more. 82. The best way to assess a student's professionalism is A. Written test only. B. Observation during clinicals. C. Attendance record. D. Skills lab score. 83. An instructor reviews their lessons and updates based on feedback. This demonstrates A. Rigidity. B. Administrative compliance. C. Reflective teaching practice. D. Failure to follow procedure. 84. To handle a student with a learning disability. A. Exclude them from skills testing. B. Provide reasonable accommodations without altering objectives. C. Give them extended leave. D. Reduce their workload. 85. CNA instructors must assess both A. Academic writing and ethics. B. Skills and attitudes. C. Dress code and exams. D. Absences and group work. 86. If a student refuses to perform personal care, the instructor should A. Fail the student. B. Counsel the student and review expectations. C. Report them to the Board of Nursing. D. Reassign permanently. 87. CNA students can best learn documentation by A. Reading policies. B. Observing instructors. C. Practicing charting in real or simulated environments. D. Watching videos. 88. What is the role of evaluation in instruction? A. To give grades only. B. To diagnose learning needs and guide improvement. C. To weed out poor performers. D. To fill time. 89. A preceptor is not a good fit if A. They are new to the role. B. They are highly skilled. C. They lack patience and communication skills. D. They work on a busy unit. 90. A CNA trainer promoting autonomy will A. Do everything for the student. B. Discourage student decision-making. C. Encourage independent skill performance. D. Grade only group work. 91. Learning styles refer to A. Preferred learning conditions of adults. B. CNA state laws. C. Instructor demographics. D. Legal preferences. 92. Instructors must prioritize A. Discipline and enforcement. B. Compliance, safety, and learner success. C. Finishing lessons early. D. Avoiding feedback. 93. CNA training includes both A. Ethics and billing. B. Legal procedures and mental health only. C. Didactic and clinical components. D. Medical terminology only. 94. Which tool can help identify at-risk students early? A. Skills logbook. B. Summative test scores. C. Daily performance tracking and feedback. D. End-of-course survey. 95. Which of the following fosters emotional safety in the classroom? A. High-stakes grading. B. Instructor sarcasm. C. Respectful, non-judgmental communication. D. Surprise exams. 96. Instructors must model A. Only verbal skills. B. Clinical accuracy, empathy, and professionalism. C. Silence in crisis. D. Independence from standards. 97. The purpose of clinical objectives is to A. Fill paperwork. B. Replace skills labs. C. Define expected outcomes and guide learning. D. Reduce instructor oversight. 98. CNA instructors should regularly A. Take attendance only. B. Observe students in isolation. C. Reflect on their teaching and adjust accordingly. D. Skip evaluations. 99. CNA instructors help meet workforce needs by A. Over-enrolling students. B. Preparing competent, compassionate caregivers. C. Lowering program standards. D. Relying on lecture-only formats. 100. Which is an ethical violation by an instructor? A. Following curriculum. B. Showing favoritism. C. Offering help. D. Referring students for tutoring. 101. Which action best demonstrates professional boundaries during CNA instruction? A. Socializing with students outside of class. B. Accepting gifts from students. C. Maintaining respectful, objective communication. D. Sharing personal medical experiences. 102. What is one responsibility of a CNA instructor during student clinical placement? A. Rewriting facility policies. B. Delegating medication administration to students. C. Supervising and evaluating student performance. D. Scheduling staff assignments. 103. When planning instruction for a CNA course, the instructor should first A. Choose textbook chapters. B. Review OBRA requirements and learning objectives. C. Design skills checklists. D. Create quizzes. 104. A student makes a minor but repeated documentation error. The best instructor response is to A. Ignore the mistake unless it's critical. B. Wait for the final evaluation. C. Provide immediate correction and reinforcement. D. Report the student to the licensing board. 105. What is the best method for CNA instructors to remain legally compliant? A. Allow experienced students more flexibility. B. Stay current with federal and state training regulations. C. Use outdated, approved curricula. D. Follow the facility's informal practices. 106. A student expresses concern about their ability to learn new skills. The instructor should A. Tell them to work harder. B. Pair them with a peer tutor. C. Reassure them and explore learning strategies together. D. Postpone their evaluation. 107. Which technique is most effective when teaching psychomotor skills? A. Reading a chapter aloud. B. Watching a video silently. C. Step-by-step demonstration followed by student return demo. D. Assigning homework. 108. A CNA instructor's behavior must model A. Clinical knowledge only. B. Professionalism, integrity, and accountability. C. Strict authority at all times. D. Administrative compliance only. 109. What is a common sign of student disengagement? A. Frequent volunteering. B. High test scores. C. Avoidance of participation and poor eye contact. D. Asking clarification questions. 110. when planning lessons, CNA instructors should consider: A. The instructor's availability. B. Facility meal schedules. C. Student learning styles and pacing needs. D. Historical curriculum structure only. CNA Instructor. The CNA Instructor exam, often required for those entering train-the-trainer or preceptor roles, evaluates the knowledge and skills necessary to effectively teach and mentor certified nursing assistant or CNA students. The test focuses on adult learning principles, curriculum development, instructional strategies, student evaluation, clinical supervision, and regulatory compliance. Candidates must demonstrate an understanding of how to facilitate both classroom and clinical instruction, promote ethical and safe practices, accommodate diverse learner needs, and meet federal and state training standards such as those set by OBRA. Success in this exam ensures that the instructor is qualified to prepare future CNAs for competent and compassionate care delivery in long-term care and other healthcare settings. Here are the top 5 beneficial uses of CNA Instructor exam. 1. Ensures instructor competency. The CNA Instructor exam verifies that candidates possess the necessary knowledge, teaching strategies, and clinical skills to effectively train future CNAs, ensuring instructional quality. 2. Standardizes education delivery. It helps maintain consistency in CNA training programs by ensuring instructors meet standardized criteria aligned with federal and state guidelines. 3. Improves patient care quality. By certifying qualified instructors, the exam indirectly enhances the competence of CNA graduates, leading to safer, more compassionate, and skilled patient care in long-term and clinical settings. 4. Supports regulatory compliance. The exam helps institutions and instructors meet OBRA and state training mandates, protecting program accreditation and licensure. 5. Promotes professional development. It encourages CNAs to advance their careers into educator roles, fostering leadership growth and continuous learning within the healthcare workforce.